Okay, go for it, Teresa.
Amanda, did you turn the screen sharing off?
Yeah, I'm getting there.
Okay, I think you have all the controls now.
Yeah, I do.
Okay,
Unfortunately, I'm
that's all
sorry.
right. That's all right. I'm happy to relinquish.
Okay, you should be co-host again, and this is recording.
Okay, doke.
Do you want to go ahead and get started?
Sure.
Do you want me to introduce or?
Um, Welcome everybody. Thanks for joining us. This is the Public Health Action Network and the Air Support Project's twice a month Zoom discussion chat. Today we're joined by Marisa Swanson and Ariana Zwern. They're young adults living with long COVID. I'm Teresa O'Connor. I'm the communications manager for chat. For PHAN, Public Health Action Network. Um, Melissa, can you introduce yourself?
Sure. I'm Melissa Smallwood, co-director of Air Support Project. Also active with the WHN broadcast. And Marissa, I think at one point we actually wanted to have you on WHN broadcast talking about this specific topic. Although it didn't end up happening, but I'm really glad that we're able to have this conversation with you now. Yeah, the topic for this community call is long COVID in young adults. So, what happens, to people at the, start of their life, college age, being struck down by, this devastating illness. And, our colleges and universities and institutions not doing much to prevent that or address it.
Indeed.
Uh, Go ahead.
Uh, I will let folks know that you can find out about future events from PHAN and ASP on our websites, publichealthactionnetwork.org and airsupportproject.com. We'll be hosting another podcast discussion. Another Zoom discussion on Thursday, April 2nd.
And what's that one on?
Let's see.
Our next one is on performing arts and COVID.
That's right. That's right.
Yeah, that'll be fun.
We'll have a couple of people who organize clean air events and some musicians who are committed to taking part in clean air events.
Well, yeah, looking forward to that one.
Absolutely.
But
That'll be fun.
Yeah,
yeah,
we've got really fun performers and people who organize these events. I'm looking forward to this one. So,
getting into our current topic. We have our two guests today, Marisa Swanson and Ariana Zwern. Marissa, would you like to briefly introduce yourself?
Sure. My name is Marisa. I'm from a small town in rural northern Nevada, and I got COVID for the first time in December 2020 when I was 21 years old. I'm now 27 and I have been living with long COVID ever since.
and Ariana, tell us a little bit about you. Where are you now? Where were you before in school?
Yeah, my name's Ariana. Also, I go by Ari often. I am 24. I'll be 25 in May. I got COVID shortly before my 21st birthday, while I was studying at Brown University. I can definitely tell more about that story, but it definitely
Yeah.
was a very rapid juncture in my life and kind of changed my trajectory. And I'm definitely still dealing with the aftermath of that medically and psychologically.
Yeah, and I see glimmers of the you that you were before coming through so strong in our messages sometimes. It's I wow, I wish I could have seen you at 100%. You must have been a force to reckon with.
Thank you. That's so
You
sweet.
still are. You still are. You really are. Um, Marissa, let's swing back over to you. So tell us a little bit about when you got sick. Like, where were you at the time? What were your thoughts on COVID before all of this? And then how did that change?
So, December 2020, I had pretty recently graduated with my bachelor's in psychology from the University of Nevada, Reno. I graduated in August of 2020. I was actually planning to go to law school and wanted to take or was required to take the LSAT to get into law school. And I got COVID about 3 weeks before I was supposed to take that exam.
Oh,
And I never ended up taking it.
wow.
So I didn't go to law school, but I'm kind of glad I didn't because I found a real passion for public health instead. I always cared about COVID. Even before I got sick, I was very careful to not get sick. Unfortunately, a family member brought home COVID from college, and I couldn't avoid getting it. But after I got sick, I got into crisis counseling, and I really knew at that point that I wanted to address long COVID and get into public health. So I pursued a master's of public health starting in January of 2022, and I pretty recently graduated with my master's of public health as well. Um, I got that in August of 2025.
My God, congratulations. That's
Thank you.
awesome to
It's a
hear.
big, big achievement.
Well, tell us where else you're going with this because you don't have to if you don't want to, but I know like the next step here. But if you're comfortable sharing, please do.
Yeah, so I just applied and was offered admission to an epidemiology and clinical research program at the University of California, San Francisco. I do hope to accept that offer and move to San Francisco this July and research long COVID with some of the researchers at that amazing institution.
Not just
That
and
is fantastic news to hear.
how did you find them? I love this part of the story. How did you find them?
I heard a lot about the long COVID research happening at UCSF through the sick times, actually.
Yep,
Um, Particularly the research being organized by Dr. Peluso at UCSF.
that's awesome.
And I actually had a meeting with him recently to discuss how to move forward and how to really get involved in research once I get there.
I love that. Actually, when you told me that, I shared that with Miles Griffiths at the Sick Times. I was like, hey, look at this. This is what your work did. So thank you for speaking up and for being part of the community and for doing something like this to give back to the community. That's amazing to me.
Thank you.
Um,
So proud.
well, Ariana, let's switch back over to you. Ari, tell us a little bit about where you were, what was going on in your life, and
Sure.
how things were before COVID.
Sure. Similar to Marisa, I was always, very informed and socially conscious about everything. And when COVID sort of started disrupting my senior year of high school, I was always a strong, advocate for wearing masks and social distancing, and really, really struggled with that general apathy among my peers. And um, when I finally got to Brown, which they delayed our start by a semester, so they had us come like spring summer that first year, in 2020 to 2021. Or I guess at that point it would have been 2021 when I started. Um, and similarly there, I was always really good about masking. I got the vaccine as soon as it was available. I got J&J and then later a Moderna booster before the time that I got COVID. And I did, pretty well with the social distancing and masking. I didn't get sick for a couple of years. And then as things started opening up in 2022, I, became more active in person with the varsity equestrian team at Brown, which I, rode on competitively, and we also had a lot of weightlifting requirements, so I was in our varsity gym a lot. And actually, the day I tested positive for COVID was like early April, shortly after we'd come back from spring break. Um, so I guess someone had, not done the thing we were supposed to do, which was take a COVID test before our competition the previous weekend. And I'd caught it from them. I remember being at lift, and I was used to being able to deadlift my body weight, and I couldn't get it off the ground. And I went to my lift coach and was like, I don't know what's wrong with me, but I need to go home. Like, I really am not feeling good. And um, went home, tested positive for COVID, quarantined for 2 weeks, and never, made it back. I wasn't hospitalized. It was, had a high fever for a few days, but had no reason to assume that I'd have any issue with it. I was healthy, strong. I was in honestly the best mental and, physical health of my life at that time. Really thriving academically and physically and socially. But I started having issues just walking to class, washing my hair, like, basic functions for a 20-year-old young adult. And again, like, this was a month before my 21st birthday, so I was really in many ways like still a kid, but um, since then I have really been wrestling with, the U.S. healthcare system. I studied public policy at Brown, so I always kind of have an eye on the more expansive implications of like every barrier I encounter with the healthcare system. That, like, this is not just me, this is a systemic issue. But just by way of example, like, one of the things COVID did to me was cause pretty severe gastroparesis. It took me 3 years, three GIs at three hospitals to convince them to order a gastric emptying study. When they finally did,
Oh my God.
it was only 2 months between the time I was diagnosed and the time that I was like admitted to the hospital with like critical malnutrition, dehydration, coded, was there for 2 weeks. They placed a feeding tube. Like, they literally almost let me die. And every time the refrain was like, nausea and vomiting is normal in young women with anxiety. I heard that so
Oh,
many times from so many doctors. And
oh my
um,
God.
it's,
That's
yeah,
horrible.
it really
I'm
is. It
sorry.
really is.
Yeah.
And I think this is something that is not unique to me. Like, I speak with other young adults, and overwhelmingly the consensus is that the doctor looks at us and says, "Well, you look fine to me. I don't know what you're doing here." I go to a cardiologist and they ask, "Oh, who are you picking up?" I go to pain management and they say, "You're too young to be here. What are you doing in this office?"
Oh,
Um, and I think that our like medical infrastructure is just not really prepared to deal with these kinds of illnesses that
yeah.
are striking down young people that don't have any obvious predisposing factors. So that's something that I've really been reconciling or reckoning with. And yeah, I was supposed to also stay at Brown for a fifth year master's program, and ultimately
Oh,
was unable
yeah.
to do that. I did wrestle through and get my bachelor's, which I am proud of, but
Amazing.
it was it was a rough one. Like, my last semester of school, I didn't see my friends literally until the day we walked to graduation. All I did was like eat, sleep, and do my homework, and I didn't have energy for anything else. So
That's still really amazing. I know how sick you've been, and that's
yeah,
amazing. Congratulations.
thank
Oh
you.
my gosh, that sounds so hard. Um, do you think that the doctors were uh kind of typecasting young women as being anxious? Is
Yeah, I think that's definitely a prevalent issue in our, medical system. That's that specific bias. I mean, my primary care at the time, who was the director of Brown's Health Services, he told me, "You're too pretty to be as sick as you say you are."
Oh
That's
my
something I could
gosh.
never imagine a doctor
oh
saying
my,
to a young man. Like,
yeah.
there are some specific biases about the health of young women. Um, that are definitely in play here, and it's been really battle for me. And amazingly and also unfortunately, like, since last year when they placed the feeding tube, I've had so much less issues with getting doctors to like take me seriously. Like even when I see providers for completely unrelated problems, the mere fact of having like an externally visible representation of my illness overcomes that hurdle. And while that's definitely allowed me to like make more progress in my care in the past year, it also makes me really grieve for the version of me that was just as sick and
Yeah.
not validated by my providers for so many years. So,
Yeah, I feel
uh,
you on
Yeah.
that. Like not having hair, I feel like is a visible sign that there is something wrong. Please
yeah,
look. But if I didn't have that, we
Right. So it
wouldn't take
yeah,
helps
anything
doctors
seriously.
take you more seriously, but
Yeah.
yeah,
But I
my
mean,
goodness, it should not come to that. My God.
yeah.
especially for, trained professionals who should know better than to
It doesn't matter
fall.
that they should know better. They don't. They still do these things.
Yeah, yeah. I
They
mean,
still do these.
even 2 weeks before I was admitted to the hospital last year, I saw my primary care was begging in her office for nutritional intervention, like a nasal tube feeding, and she told me weight loss is a silver lining of your condition. You
Oh
look
my
great to
God.
me. She
Ugh.
her recommendation was for me to like see a psychiatrist, which I was already doing, and she didn't even order laboratory studies. And when I was admitted to a hospital 2 weeks later, I had pancreatitis, issues with my gallbladder, issues with my liver. My blood pressure crashed to 49/30. Like, I was literally like brink of death, and she didn't bother to order labs because she was just like, well, at least you're skinny, you know?
Oh my God.
And like
How
Wow.
that is our
how can
society
prof-
that believes that
how
it's
can
attractive to
profession
be medically emaciated. So,
how can professionals be that incompetent?
Well, they are,
And
and that's why we're here.
yeah.
They are.
yeah. I mean, what baffles me is, almost everyone in our society, except for the people who have been, basically quarantining themselves and segregating themselves away from society, have been infected with COVID multiple times. We know that what God, what is even the number of estimated people with long COVID?
Oh, over
Right.
400 billion, or I'm sorry, over 400 million worldwide.
400 million. Yeah, 400 million worldwide.
That was 2 years
And it
ago, so
causes
it's probably more now.
Oh, absolutely. Um, we we know that it causes, these weird wide array of symptoms in so many people, and it's like, how are doctors still this
Well,
clueless?
that's why we're here. That's why
Yeah.
we're here. We're telling you our experiences, and this is still happening.
Yeah. Yeah, I mean, Marisa has definitely great, insight into what it's like to get COVID over and over and over again and to, develop new sort of consequences every time, especially like living in a, rural environment.
Mm. So could I jump in with a question? So when COVID started in 2020, I had just turned 40, right? So I'm an ancient relic of the old world. I'm over the hill. So I don't know what it's like to be, a young person in the pandemic world, right? So uh, being young, did you see your youth as sort of a comfort? Like, did you think, because I'm young, because, I'm not as old as this guy, I'm a little more protected. Like did you feel a little safer because you were younger? Did the messaging from public health and, the public sort of convince you that you didn't have to worry as much, or were you sort of always, researching enough to be like, yeah, we do need to worry about it, even though we are, young?
I personally was always worried about it. I'm kind of in a unique situation in terms of being sick both before and after COVID, although way worse after COVID. Um, I have a genetic lung disease called alpha-1 antitrypsin deficiency, as well as chronic asthma. So I was always very worried about COVID because I knew that if I got it, it would potentially shut my lungs down, cause pneumonia, really affect my respiratory health. And that has been the case. Every time I've gotten COVID, I've needed steroids to keep breathing. So it has always been a very big deal to me. I never took my youth for granted because I already had these pre-existing conditions that I knew COVID would exacerbate.
Yeah, I would say in my case it was pretty healthy before I got COVID, and I was very careful about it, but it was more in a sense of social responsibility than fear for my own safety. Like I said, I did a really good job masking. I got vaccinated, as soon as I had the opportunity to. And I mostly just cared about protecting people in my community, because it's true that the public health messaging was that like young people are fine, only old people really have to worry, and there was no reason to expect that someone who was deadlifting their body weight in the gym 3 days a week and making straight A's in an Ivy League school would be disabled by something that was supposed to be like a common cold, unless you're elderly and or have pre-existing conditions like Marisa does. But I feel like for me personally, the the saddest consequence of that like failure in messaging has been the aftermath. The fact that like within a month I saw a doctor and said, "Hey, like I'm having trouble breathing. I'm breaking out into hives. Do you think that this is related to COVID?" And then being like, "No, no, but like here's an inhaler. Use some hydrocortisone." And every time I started developing a new symptom and went to the doctor, they failed to put the pieces together or even acknowledge that I could be onto something when I put the pieces together, and just said like, "You're young and healthy." A refrain I heard over and over was like, "It's just deconditioning, like get back to the gym, push yourself, you'll get back where you were, like it's just going to take a minute." And unfortunately, pushing myself probably it was a huge contributing factor in becoming as disabled as I am, where like I'm in palliative care and getting like home caregiving services now. Maybe I'd be better than I am if they hadn't sent me straight back to the gym and just said keep trying, you're not trying hard enough you know so that I think
I
was
agree.
was was the biggest failure, just the assumption that like a young adult got COVID, like there was an easy path to recovery and there wouldn't be any kind of lingering consequences.
Yeah,
And
so
I
even
thought,
though it didn't really convince you to not take it seriously, still that false sense of security that was, society wide still, had a negative impact on both of you because, if you're talking to someone and you're, hey, could this be my COVID? And they're like, oh, no big deal. It's not, nah, couldn't be that. I mean, whatever. You're young, right? Like,
Yeah,
yeah, I mean, it's terrible and it shouldn't have happened.
and
yeah.
Um,
it sort of answered my next question for you. At what point did you realize, hey, I think this is long COVID?
I started researching pretty much immediately. Like when I, got out of quarantine and started having these kind of lingering effects, it was like, is it possible to be sick after having COVID and recovering? And there were already plenty of stories, but I think part of that was that it was spring of 2022 when I got COVID. There were already people who had had long COVID for 2 years at that point. So even though it was, doctors still were not prepared to treat it or, kind of in the know, I think there were plenty of people, on Reddit and Facebook and places like that saying, "Hey, I got COVID and like now I'm disabled." And some of those people were young like me and didn't have pre-existing conditions. So I caught on pretty fast, but that's also partly because of my like analytical mind and propensity to research anything I don't know the answer to.
So it
You.
was folks on Reddit and and Facebook who really kind of helped you connect the dots.
Yeah, but it was convincing other people, specifically medical providers, that that was what's going on with me. That was hard because for the first year, again, they were just saying, "Oh, you're just anxious and deconditioned."
What about you, Marisa?
Similar story. I did a lot of my own research. I've been doing a lot of my own research for as long as I can remember. I have this rare lung disease that took 16 or 17 years of my life to get diagnosed. Um, and I also mainly connected the dots through Facebook. I think that I had at the time my Alpha One coordinator, um, she mentioned long COVID. And from there, I started doing my own research. And I did get infected in 2020. And I know that a lot of people had long COVID for several months. At the time, I was infected in December of that year. But there was still so little knowledge and just information out there. Um, it was difficult. Facebook was really more helpful than anything else. And after I connected the dots by using social media, I went to my primary care physician and said, "Hey, I think I have what's known as long COVID." And thankfully, I have a phenomenal PCP, and he agreed with me.
Awesome.
Awesome.
Yeah, my
And
PCP was the
rare.
same way. Like, I think everybody owes my PCP a lot for listening and believing all of us.
Yeah, same with my PCP. He's been just absolutely amazing. I, I'm so grateful that he has never treated me like Ari has been treated by so many of her healthcare
Right?
providers.
Yeah, yeah. What's really ironic, Ari, one of the very first research papers to come out of our group was actually done by motility specialists, GI motility specialists. So
Interesting.
we've known this from the beginning, like this is an outcome.
Yeah. Yeah. But still, every time I tell someone that, they're like, really? COVID can paralyze your stomach? I never heard of that. You know?
Yeah,
Yeah.
it's unfortunately common. Tell us about your journey, like when you first started seeking care for long COVID and you realized, okay, this is what I think I'm dealing with. Where did you go first, and what happened after that?
Sure. I mean, in the
Long story.
summer after I had COVID, I saw a pulmonologist. I was working at a rural summer camp at the time and was having a lot of trouble just like breathing and keeping up with my middle schoolers. And they, did pulmonary function tests, which in my case were normal,
Mm.
at rest. And he said, "Well, nothing's wrong with you here. Your X-ray is normal. Your PFTs are normal. So like, what are you? Why are you here? What are you doing?" When I went back to school, I again frequented my university health services with a number of long COVID related complaints. I was seeing the doctor there at the time who told me I was too pretty to be as sick as I claimed. The only good thing that he did for me was eventually, after maybe a year, maybe a little longer, write a referral to the long COVID clinic at Boston Medical Center, which was about an hour and a half, 2 hours away from my university. And I did start seeing there a really awesome nurse practitioner who was, knowledgeable about long COVID and referred me out to some other specialists. So probably around the time I was 20, 22, I started getting, much better kind of workup and started having, abnormalities in my like EMGs and showing kind of objective evidence of like issues with my nerve fibers. And, I got neurocognitive testing that showed dramatic decline from my previous testing when I was diagnosed with ADHD in 2021 or whatever. So, um, yeah, it took a while to even just start seeing providers who cared enough to actually investigate. But certain things like the GI issues even took several more years after that.
Yeah, that had to have been so frustrating, especially with the GI issues.
Yeah.
And I'm sorry, my computer is doing a weird thing here. What do you think has been? Do you think you've had like any aha moments along the way, or any like I don't know. What do you think have been some standout moments in this
Mm.
journey?
Well, I can tell you that in the end of February last year, when I went in for fluids because I was so dehydrated. I hadn't peed in 24 hours and was passing out every time I stood up, which was a common occurrence when my GI problem would flare. And this ER doctor, out of all the ER doctors, for whatever reason, decided to order lab work, including like a lipase test, which was like over 5 times the upper limit of normal. So that they were concerned about pancreatitis, did a CT, diagnosed pancreatitis, and this doctor walks in to talk to me about my CT results, and she says, "I have bad news for you. We're gonna have to keep you overnight. You have pancreatitis." And I swear to God, I like almost leapt out of the bed and jumped for joy because I was like, I know if they admit me to the hospital, they can't discharge me if I can't eat and drink. Like I'm aware that there's
Right.
a law that says that. All like I was like, I've been going to the hospital like every, month for several months with critical dehydration. They just give me fluid, send me home, and then I'm, back there 2 or 3 weeks later. So I was like so excited about getting admitted to the hospital with pancreatitis, and like that I think was a moment that really stood out to me of like this is like how badly our healthcare system is failing, that like I'm 24 years old, I'm in the ER and I'm leaping for joy that like I have a potentially life-threatening problem because I'm so desperate to get admitted to the hospital so that somebody will actually help me. And that was exactly what happened. Like when it was like a Friday night when I saw the GI Monday morning, they were like, yeah, okay, you have pancreatitis. We're less worried about that than the fact that you got pancreatitis because you can't like drink enough water to, you know, hydrate yourself and maintain your blood volume without just throwing it up. So that I mean is I wouldn't say is a highlight, but it was
Right.
definitely a
Yeah.
moment for me that really like brought home, you know, just how messed up this whole system is. Like nobody should be excited about getting admitted to the hospital.
Right. Yeah.
And
And you,
how,
we
oh,
always say you're your own best advocate, but you really are your own best advocate. I watched you every step of the way, and it's
Yeah.
amazing.
how long after you first got COVID was it when you got admitted to the hospital?
I had COVID in April of 2022, and this was end of February of 2025, so 3 years.
Oh my goodness. Wow.
Yeah, and it was
Marisa,
a
did
rough
you have an
three
aha
years.
moment?
Um, so I've had multiple infections. The first one mainly caused POTS. It was very cardiovascular, mostly. I had some other weird symptoms as well, but that's the one that really got me was the racing heart and the low blood pressure associated with POTS. My second infection triggered a whole bunch of different conditions. I was so sick. It triggered autoimmune thyroid disease. It triggered myalgic encephalomyelitis or chronic fatigue syndrome, MECFS for short. Um, it triggered diabetes. And I had no clue why I was so sick for so many months. That second infection occurred in June of 2022 when Omicron was really bad or starting to get really bad. Um, I didn't get positive blood work for thyroid autoantibodies until January of the next year. So January of 2023. And then I wasn't diagnosed with diabetes until I believe May of 2023. And it's it's interesting, like Ari said, you almost want to jump for joy when you experience a new diagnosis because it's validating. It's like, oh my gosh, yes, there's something wrong with me. It's not all in my head. There's a physical problem. There's treatment for it. Finally, it's being acknowledged and it's being addressed. But I did not experience even close to what Ari went through. I mean, like she said, it took 3 years for her gastroparesis to be taken seriously. I ended up with gastroparesis from COVID as well, and my PCP pretty much immediately started treatment for me for that. But some of the other things did take a while, and yeah, it is kind of an aha moment to finally get those diagnoses.
Yeah.
It's validating, right? I mean, it must be terrible to go to people whose job and expertise is in the field of finding out and and dealing with what's wrong with people, and then both of you, you have different experiences, but I mean, you're still feeling it to the some degree. But with Ari, where it's like, hey, I gotta have the worst possible thing happen just to get someone to take me seriously.
Yeah.
You know,
Yeah.
that's terrible.
And it wasn't for lack of trying. Like I'd seen probably 50
Yeah.
doctors
Right.
already before that. Like, you know,
Yeah.
Yeah, it's crazy. It's crazy.
That's
Yeah.
astonishing. You had to see so many doctors. Oh my
Yeah.
goodness.
Yeah, I mean,
Um,
and I still
Should
see
never
like a
happen.
roster of providers who are like, like still unanswered questions. Even just in the past year, I've had an issue with like pretty severe neutropenia, like white blood cell counts around like 2.1, neutrophils around zero point 0.7. Normal is like 5 to 11 for white blood cells. So significantly lower than the lower limit of normal. And I've seen hematology several times. They have no idea what's causing that. I had a bone marrow biopsy last week, so hopefully hopefully they'll figure it out. But hematology is basically pointing fingers at rheumatology and saying we think this is lupus, and rheumatology is saying, well, your specific autoimmune markers are normal, so we don't think it's lupus. And they're kind of just, you know, pointing fingers back and forth at each other, but not actually speaking to each other because, of course, that would be too unreasonable. Um, and
Yeah.
I'm left here going, okay, well, now I'm immunocompromised and I need to protect myself, but nobody can tell me like what is causing this and whether or not we can fix it. So I feel like that is the way of COVID, that even years later, you're always, it keeps you on your toes. Like there's always something new to reckon with. It's never like just one thing. It's kind of this amorphous disease that is constantly like changing and affects everybody differently. And there's no like, it's long COVID, we treat it with this, and that's the end of it.
I want to shift a little bit to where obviously we've all had to change the trajectories of our lives, and that's changed dramatically in this room. But what are some things that you've been holding on to, like a direction that you think you can go now from where you are with what you have? Because I certainly see, like I have, when I think of you, Ari, I think of like all these things where I can plug you in, and I know that your energies are limited, but you are on my mind a lot.
Yeah. I feel like this experience of chronic illness has forced me to be a lot more selfish, and I know that that term has a negative connotation, but I think in my case it's been a good learning experience. I've always been very involved in various forms of social advocacy, and I think that a lot of my energies right now have turned towards advocating for myself, specifically fighting with my health insurance company about a number of things. Um, so I'm spending a lot of time and energy. I'm also learning a lot about the U.S. healthcare system through my own kind of lived experience, and I hope that if I reach a place of better stability and more energy, that I can, redirect that outward a little bit more. I intended to study healthcare policy in my master's program. Unfortunately, like that opportunity is not going to be my next step anymore, but I do think that there's a role for my kind of passion and knowledge in this
Yeah.
area, whether that be, part-time patient advocacy in a hospital, or writing a memoir about my encounters with the US healthcare system, or something. I'm not sure what that is right now. At the moment, I'm very much still like in the survival mode, but
Right.
um, yeah,
Well, that is something
I hope to apply this experience in my future for sure.
I'm glad that you have a written record, at least in the Facebook group, because that's a powerful statement right there. You
Yeah.
know. What about you, Marisa? I know we've kind of talked about it a little bit, but I'm excited to see where this takes you.
Yeah, my main goal in life right now is to use my experiences to further long COVID research. I have always wanted to be in long COVID research pretty much since I got long COVID and I got into public health. Um, and now I'm actually doing it. I have been incredibly fortunate to actually have some improvement in my symptoms. I go to the Stanford Long COVID Clinic, and they started me on a regimen of low dose Abilify, which they're using
Yeah.
for both long COVID and ME/CFS,
Mhm.
and it has helped me tremendously. There's no one size fits all, and I don't think it works for everybody. But for me personally, it has actually made it possible to where I can pursue this opportunity at UC San Francisco and participate and contribute to long COVID research. Um, and my experiences truly fuel me. They drive me to do this. Um, I know how much people are suffering and have suffered and continue to suffer. So I desperately want to address it.
Yeah. And who better? Like who better? Thank you. And I kind of want to talk about, I want to get back to something that I know is very dear to Ari. Let's talk about some of the more macro and structural challenges, like with Social Security and the lack of a safety net. I think we can both speak to that. But I
Yeah.
you.
Yeah, I think there's some specific challenges that young adults with long COVID face when it comes to the sort of macro support around long COVID and disability in general. I don't know how many of you guys are aware of this, but Social Security benefits are based on work credits. You need a certain number of work credits based on how old you are. If you become disabled before age 24, you need 6 work credits in order to qualify for disability, which is equivalent to about $10,000 of wage earnings. And this, I think, is really difficult for young adults with long COVID and other illnesses, specifically as college students, because I know in my experience, like I was a senior in high school when COVID hit. I did, work that summer in as an essential worker at a grocery store. During college, I, worked part time. During school, I worked in the summers, but I went straight from high school to an Ivy League college from the time that I was 2020 until I think maybe I was still 19 when I went to school in 1920, and then I got COVID shortly before my 21st birthday. So the question then is like when are you expecting young adults to have made $10,000 of wage earnings when they're a full-time student and they got sick before they were even old enough to be able to drink alcohol? You know what I mean? Like that I think is oftentimes an unreasonable expectation, and especially, coming out of Brown with life-altering disability and also a lot of student debt, it is extremely frustrating for Social Security to say, well, you should have been working, you didn't contribute, so you don't get anything from us. This social safety net is not available to you. Because in my mind, I did exactly what I was supposed to do. I worked really hard in high school. I got amazing grades. I did well on my SAT. I got myself across the country to attend an Ivy League university. I applied myself there. I, studied really hard and made straight A's and, competed on a varsity athletics team. Like I was doing exactly what I was supposed to be doing to set myself up for a productive, career and a life where I would do important work and contribute meaningfully to the world and also make a reasonable income and pay off my student loans. And then I got bowled over by COVID by no fault of my own, and the social safety net says, sorry, this isn't for you. This is only for older adults that have been working longer. So that's something that has like really stood out to me as like a failure in our system, that we don't have an infrastructure to support young adults who become disabled, and like that never changes, and at no point does that become available to you if you didn't put in enough years of work before the time at which you became sick. And so it's not just that like we don't have, as young adults, we don't have as strong social supports like marital structure or children to take care of us, or a stronger community of decades long friendships of people who will show up for us. It's also sort of the political and social and financial infrastructure of our country, saying, we have a safety net, but not for you.
Right. You're so right, especially when I've seen this. I've written papers about this in other cultures and other countries, but it is very true here too. We also have an entire economy it's built on the back of gig workers who don't pay into that system, and they have nothing either.
Yeah.
So yeah, we're in a quandary here.
Yeah.
Are there? Sorry, I stopped. Hello. Marisa, what would you say if you could go back and tell yourself or anyone else something going into long COVID, like it's inevitable, you've got it. What would you tell past you or someone else?
Oh, that's a good question. Well, I think I would tell past me to avoid my brother at all costs so that I didn't get it in the first place.
Right.
But if it's inevitable, um, I would say to try to get into a long COVID clinic as soon as possible. Um, they have helped me so much at Stanford, um, more than any other healthcare provider has been able to, just because they have so much knowledge and they're doing so much research. Um, I got into the long COVID clinic in January of 2023, and they were the ones who finally figured out I have autoimmune thyroid disease. Uh,
Mhm.
they were the ones who put me on the regimen of low dose Abilify, which I don't think any primary care doctor would be knowledgeable enough about to even consider. My doctor knew nothing about it, and he's amazing. He's phenomenal. Nothing against him at all. He just doesn't have that knowledge. Stanford does. So yeah, that would be my recommendation to myself, to just get into this long COVID clinic as quickly as you possibly can, because they are going to make your life better and they're going to validate you, like I said before.
Yeah. That
What about you,
itself
Mary?
that itself I think can be, a challenge. Like I live near Sacramento. UC Davis used to have a long COVID clinic, but they closed it because their sort of statistics of um, patient satisfaction and things, analytics that are based on like cure rates and things like that are not really applicable in long COVID, weren't satisfactory to them, so they just shut it down. And I've been fighting Anthem for about a year now, maybe a little bit more, to get approval to see a doctor at the same Stanford long COVID clinic where Marisa goes, and Anthem says, well, they're not in our network, and we can offer specialists for your conditions in your county. And I'm like, okay, yes, but it's piecemeal system. I can see a pulmonologist, a cardiologist, a hematologist, a dermatologist, an endocrinologist, a rheumatologist. The list goes on and on and on, and I do, but I don't have anybody who's looking at the full picture. And that's really what a long COVID clinic can offer that other specialists cannot, is someone who's looking at all of these symptoms together and helping to orient you towards which things are priorities, and to coordinate, referrals to the types of specialists that can make the most improvement. And unfortunately, those sorts of clinics are not available all over the country, and even when they are, health insurance does not always make them accessible. So that's definitely an area that we can make improvements.
There hasn't been one in the state of Kansas in several years.
Yeah,
There's one right across the state line in Missouri, but you have to be a Missouri resident to use it. So
yeah, that sucks.
yeah, it really does. And the clinic there actually does a pretty good job. So it's here, but
But you can't reach it.
yeah.
Yeah.
So if there's something that like, if you could tell the world three things, what would you tell the world right now? Any three things.
I would start off by saying that anyone can get long COVID. It doesn't matter how old you are, how healthy you are. If you've been infected before, you can get it, and it can ruin your life. It can be absolutely disabling. So be careful. That's the number one thing.
Yeah.
Agree.
I would say, like, an important thing for me to voice is just like, we're here. You don't see us. We're not at the club with our peers. We're probably not, many of us are not in school anymore. We're not, you know, wreaking havoc in the streets like other kids in their young 20s, but we're still here. We're still fighting. We still need support, and uh, don't erase us, because we need help. And, you know, I don't know. there was a moment in the hospital where they told me like we can put you on IV nutrition here and then try to come up with a plan. You can be here for a while. We can put in this feeding tube and send you home, or we can put you on hospice. And those sorts of conversations when you're 24 years old, not a conversation that you want to have, but I think that part of what makes it unique to experience young COVID as a young adult, and probably also as a middle-aged adult, is that we still have so much life to live. Like, it's really not even a choice to just like give up, give in, because if I can figure out how to like stabilize my health, I could have another 60 years of like good life ahead of me, So it's really worth it to keep fighting, and I really hope that our medical system realizes that and comes to realize how much of a waste it is to like let us fall by the wayside, because our generation is going to be responsible for a massive part of our economy in the next few decades, and our generation is going to be responsible for really dramatic policy change in the next few decades, and many other things that we can't do if we're constantly at the doctor's office just fighting to be believed. So yeah, we need all the support we can get, whether that's just a friend checking in with us or systemic change for young adults to get more structural support to navigate chronic illness and disability.
If anybody can do it, it's the two of you. That's I have no doubt in my mind after, I mean, I see both of you. I see both of the work that you put out into the world, and I really appreciate it. So thank you for that.
Absolutely. Something I'm curious about is how your families have responded,
Hmm.
if they've been supportive, not supportive, if they've been able to help at all. Marisa, do you have any comments about that?
Yeah, my mother is just wonderful. She has been so incredibly supportive of me, to the point where she has fought for me to stay on her health insurance plan after the age of 26, which has quite frankly kept me alive. There's Medicaid to fall back on, but Medicaid is very complicated and doesn't necessarily cover everything you need when you have a rare lung disease. Um,
Plus, a lot of providers aren't accepting Medicaid anymore.
that
Like
too.
Yeah.
even ones who used to. I mean, I've seen here in Northern California, people, ones who used to, they they're not
Yeah.
anymore. They say their reimbursements are dropping too much, and they just can't afford it, so they don't.
That's rough.
Yeah, if it weren't for my mom keeping me on her insurance, I would have lost several providers, including my primary care provider. My primary care provider doesn't take Medicaid, and he is responsible for keeping me as healthy as I have been recently. I mean, he's the one who gave me the referral to the Stanford long COVID clinic. He's the one who gave me the referral to GI at Stanford. I also have gastroparesis, but unlike Ari, like I said, mine was addressed very quickly and efficiently. So I didn't end up as sick as she did, or is complicated, right?
Yeah.
Um, But yeah, my mom has been just wonderful, not only with keeping me on insurance, but just being supportive in general. I haven't been able to work a full-time job for, well, pretty much since I got my second infection. I haven't had the energy to work a full-time job. Um, and in this country, insurance is based on employment, so you basically have to have a full-time job to have at least private insurance. It's such a systemic mess. So I'm so incredibly thankful for my mom and all that she's done. And my dad has been pretty supportive as well. He's taken me to a few appointments at Stanford. So yeah, I'm grateful for both of them.
Ari, how about you?
Yeah, my parents have been really good in some ways and also struggled in others. I am I did move back home, and I'm very grateful to them for putting roof over my head right now because, like Marisa, I've been dealing with obviously some severe health challenges and really bad fatigue related to the ME/CFS. I think that they struggled in other ways, especially early, with a lot of just denial. Like it was hard for them to reckon with the fact that their like young, healthy daughter was all of a sudden disabled by something like this, and they kind of saw what they wanted to see. Um, and I think also when they did, talk to me, it was when I was at my best and had the energy for a FaceTime call, and they didn't see me at my worst when I like couldn't get out of bed for 3 days. Um, since moving home, I think that we've had a kind of protracted process of reckoning with that. When I was like admitted to the hospital, even they, I don't know, I think kind of didn't understand like how critical that was, and that like, when my blood pressure was 49/30 that first night, that like I could have died. When they were gonna put my feeding tube in, I called them and was like, "Hey, can you come?" Because I was maybe 2 hours away from home, and they hadn't come to see me in the week ahead of that, and they were like, "Well, we have a big concert tonight, but we could come maybe the day after your surgery." And that was like a moment for me where I was like, wow, like they're just like not getting this. So we've had some kind of longer conversations. They've been a lot better about it in the past few months. I think a big transition was when I started getting home health and getting like intravenous immunoglobulin infusions in the home setting, and they like saw me on the couch for 7 hours attached to an IV pole with a nurse, staring me down and taking my vitals every 30 minutes. I think for them that was like a big moment when like my health challenges kind of was brought into the sphere of our sort of domestic life, because before that, like being sick was something I did like away from home for them. It wasn't something that kind of influenced their life or permeated their day to day. So it's been interesting to see like how they've navigated that. I think that, lately they've been making much more of an effort to support me, and I do really appreciate that. But I think it can be a challenge for patients, because for parents, because again, like you don't expect your child to be like away at school and thriving and making straight A's at an Ivy League university and sending you pictures from the gym. They just deadlifted their body weight, and then they come home for a school break and are disabled. That's not something that as a parent you imagine for your child. So definitely an adjustment period for them as well.
Yeah.
Absolutely. Yeah. And it seems like again, having something visible that they
Yeah.
that they could see that made a difference.
Yeah.
And
Yeah.
that seems to be maybe an issue with American culture, just
Yeah.
American healthcare views, where I think, Amanda, you said if if people see something is wrong with you, they're much more likely to believe
Yeah.
you. And
Yeah.
Yeah.
but if they can't see it, it's like, why are you here? What's wrong with you?
Yeah.
This can't
Yeah.
be happening.
Yeah. And
And when you're talking about
I don't think it was ever an issue of my parents not believing me, as much as just that it wasn't at the forefront of their mind when it wasn't affecting their life in a direct way. And I think that also is just, yeah, probably a product of our culture and our, focus on immediacy and less of a more expansive understanding of like what it means to like be healthy and what it means to like be a family.
Yep.
yeah, and that's and as a parent, that's just it's the last thing you want for your child. So there's a bit of denialism in
Yeah.
there with I don't want this to happen to my child. Surely not my child.
Yeah.
Yep, that makes sense. Yep. Well, I want to invite folks to post questions in the chat if you have any questions for these folks. Um, Gosh, so are there any particular treatments that really worked well for you? I think, Marissa, you said Abilify has helped you. Can you explain briefly what Abilify is and what it's done for you?
Yeah, so traditionally, Abilify is actually used as a mood stabilizer for conditions like bipolar disorder and schizophrenia, but at much higher doses than what I'm taking. I'm on low dose Abilify, 2 milligrams to be exact, And they started me on something really, really small. I think zero point 0.1 milligrams of Abilify. They actually gave me liquid medication and an insulin syringe to be able to
Wow.
take this minute dose of medication. And then I titrated up from zero point 0.1 to 2 milligrams. And it has helped so much. The idea is that it helps reduce inflammation in the central nervous system. And in many long COVID cases and ME/CFS cases, the leading theory is neuroinflammation. That's what causes symptoms.
It's funny. I've been on Abilify for years now, and I think I think that's been helpful for me in this long COVID experience.
Yeah, for me, it's hard to say like that there's been any, one thing. I have been taking low dose naltrexone for quite some time, and it was something actually that I researched on my own, and then I went to my psychiatrist, and I was like, look, I know that this is gonna sound crazy, but I'm sure you prescribe this for people with substance abuse. Can we do like a really, really, really low dose for all these other problems? And I gave him like a packet of clinical research and was like, don't give me an answer now. Just like read about it and then like get back to me. So he was willing to try it before it was even kind of a popular thing, and it didn't help a whole lot with like my pain and fatigue, which is kind of what I was hoping it would help with, but it did help with my sleep and immune function. Like I stopped like all of a sudden like getting a cold every single, week or two, and it helps kind of regulate the like kind of like peaks and valleys of my symptoms. Like things just got a little bit more consistent, which was helpful for me in terms of just like finding my pace and dealing with kind of the disorientation of fluctuating symptoms. Um, so that was helpful, and I think for more specific sub problems of long COVID, you know, there's been other therapies. I also just last year, like maybe about a year ago, maybe April, May, started working with a neurologist at UCSF who um, diagnosed me with like autoimmune autonomic neuropathy, which basically is like an autoimmune like dysautonomia problem with like neuropathic sort of features, like small fiber neuropathy, which is something that a lot of long COVID sufferers present with this like POTS and small fiber sort of presentation. So he's basically saying, yeah, COVID triggered an autoimmune problem. So he started me on the intravenous immunoglobulin, which I think has also really helped with a lot of the neuroimmune symptoms specifically. Like I was having a lot of issues with like grip, like dropping things a lot, and issues with kind of balance, gait, speech, like stuff like that. And that's gotten better. My heart rate has come down some. So that's definitely been really helpful. But I mean, IVIG is really a commitment. Like it takes up to a year to notice the full benefit, 4 to 6 months for initial benefit. So it's not something that you like start it and right away, see an improvement. I started in June of last year, so I'm like just starting to butt up against that year mark. Um, I think for people who can find a way to get it, like it's definitely worth trying. It's one of few treatments that can actually like make you better and not just mask a symptom. It's basically like an antibody infusion, and it works kind of like imagine if you had a cup of coffee and you put it up underneath a sink that is kind of like running pretty slowly, right? It's a sort of a dilutional effect. Like the theory of how it works for neuroimmune disease is you have bad like aberrant antibodies in your body that are attacking you, and if you start putting a bunch of new antibodies into the mix, then your body is going to basically like remove or pass on the older antibodies that are causing the issue little by little until you have sufficiently eradicated these autoimmune antibodies and replace them with healthy ones. So that's obviously a process. That's why it takes so long, but it's definitely a really powerful therapy. I think the biggest issue is that it's extremely expensive and insurance does not like to cover it. Um, so I think you know, a big part of how I was able to get that is just finding the right provider that uses that therapy routinely and has a system for getting approval from insurance. I have Medicaid, which notoriously difficult for getting things like that approved when it's tens of thousands of dollars every infusion. It's not something that you could just pay out of pocket for because it comes from human blood. So um, yeah, that's I definitely think it's worth a try in many cases, but it's a therapy that's not without its difficulties for sure.
But you did it.
Yeah, I did. I did. But I mean, it was hard. Even getting in to see the provider. Like I got a referral from my primary care to UCSF like neuro clinic, and they passed it around. The autonomic clinic said, "Well, she has headaches," and the headache clinic said, "Well, she has these neuromuscular features," and the neuromuscular clinic said, "Well, she has autonomic problems," and they just kept passing my referral around. Eventually, they denied it and told my PCP, "If you want her to be seen, submit a new referral with only one diagnosis on it." And I was like, okay, but I have multiple neural problems and I kind of want to see somebody who can deal with all of them. And I had researched and wanted to see this specific provider. His name's Dr. Martin, Pierre Martin, because I knew that he worked with kind of complex neuroimmune cases and was utilizing IVIG in his clinic. So I ended up going on the internet and using some of my research sleuthing skills that I learned at Brown to find some like articles on like PubMed or whatever and get some of his emails, like his academic emails. And I emailed him on like his academic emails and alumni emails from like every university he'd ever attended. Like I figured out what the formats were for the ones that I couldn't find online. And I just like cold emailed him and was like, here's who I am. Here's what's going on with me. I know you're interested in cases like that. I have a referral to your clinic, but it keeps getting denied. Can you help me? And within like a couple of weeks, his practice manager like called me on my phone and was like, "Hey, like we can get you in next month." So I guess my other advice would be just like be persistent, be creative. Like this system is so difficult to navigate, but just if you keep fighting, you'll eventually get the help that you need. It will be exhausting and grueling, and you won't want. Some days you'll just want to give up, but again, like we're too young. We're too young to just like throw in the towel, you know.
Yeah. Oh,
I want those 60 years of good life.
and you had to be pretty bold too, right?
What can you lose? Like worst case scenario, they
Right.
don't answer.
Right.
There's no penalty for emailing somebody out of the blue. You know what I mean? I was like, worst case, I'm right where I started. Worst case, I waste a bit of my time and energy, but it's worth it for the chance of getting time and energy back when I feel better.
It's awesome.
Absolutely. So Sarah had a question. For nonprofits that are trying to help people with long COVID, what would you guys suggest for how we can support young adults, especially with long COVID?
That's a great question. I think that if the organization is capable, helping out with some of the systemic issues that we've discussed could be highly beneficial because, like Ari explained, we don't have a great social safety net. Um, we often don't have access to Social Security disability insurance. And then when we turn 26, we get kicked off of our parents' insurance typically, and it can be really difficult to navigate Medicaid. It can be difficult to navigate other forms of disability that we may need. Yeah, if nonprofits could help support young adults as they navigate those processes, that would be wonderful.
Yeah, for sure. I think that would definitely be the biggest thing for me too is, advocating for some policy change or some sort of stopgap for young adults who need financial support. Because it is really difficult and there's no structure for us and that's not, like I might never be able to work a full-time job again. I'm never, might never be eligible for the kind of support that other older adults are, and that that's really frustrating, especially, like I'm on a Medicaid plan. Uh, I need some kind of rare surgeries that are not really available in my state. I've been fighting Anthem for basically a year now to get approval for the one surgeon in state that is out of network for my issues. And they don't want to prove it. They won't let me out of state. What would let me out of state is Medicare, if I can get that through Social Security, you know? But again, like those are things that are really difficult if you're a young adult with limited work history. So trying to find a way to change that, and also for kids, like the Social Security system, if you are disabled before you're 22, you can collect Social Security on your parents' record, which is full transparency, something that I'm exploring, and is difficult because the documentation from my first few years of long COVID is like, there's nothing wrong with her, she's just anxious. But another issue with that, which is called DAC, Disabled Adult Child Benefit, is that if you ever get married, you lose that benefit, because in our country, if you're collecting on your parents' record, it's basically they're saying you're a dependent of your parents, but if you get married, then you become a dependent of your spouse. And we don't live in a country anymore where families can really get by on just one income. It's not really reasonable expectation to say, well, will you marry me and also be my sole financial provider, because the government is going to be off the hook now. You know what I mean?
Yeah.
So I think there's a lot of issues with the way that our Social Security system addresses disability in children and young adults, that creates this like, I don't know, cycle of dependency, and especially for people like me and Marisa, who are very self-sufficient and independent and driven and ambitious, to like be stuck in this place where, like, we're dependent on our parents or eventually maybe future spouses to like care for us wholly and completely and not have any, alternative. Like that's a really precarious place to find ourselves. And yeah, I think organizations can definitely devote more time and energy towards challenging that system and recognizing that, like, we don't live in a world where that's okay anymore, if it ever was.
Yeah, absolutely. Are you uh prohibited basically from getting disability insurance ever?
Um, so I'm in the process right now of working on seeing if I can get that disabled adult child benefit that I explained, because I did get sick before I was 22, even though the early documentation is really bad from that first year of long
Right,
COVID.
because they were saying that it was all in your head
Right. They're
and
just saying
you
she
didn't
just
have
needs a
anything.
psychiatrist. She's just
Oh
anxious.
my,
She looks good to me, whatever. Like, it was probably shortly after I turned 22 that I started with the long COVID clinic in Boston, and they started actually getting test results that are like, oh, she's not just crazy. Her nerves are dying in every major muscle group, you know. So I'm hoping that we can make some headway on that. I am working with a lawyer, but it's been like a year of this fight. And again, like, if I, decide to get married 5 years from now, then I get nothing. If you get married, you lose the
wow.
disabled adult child benefit. And even if you get divorced, that benefit is not restored, which
Oh my
again creates
God.
creates that sort of dependency that you can
Yeah,
never get out of.
yeah.
So that is available to me, if I did get well and worked a full-time job, then I could, potentially be entitled to and then got worse again, I could potentially be entitled to benefits on my own record. But it's one of those things where, like, the older you get, the more credits you need, at a certain point. I think 2026 maybe, don't quote me on it. You need full-time job for half of the past 10 years basically, which, again, like, if you're 30 and they expect you to have been working half of the past 10 years since you were 20 years old, that's really hard if you've been dealing with disabling health conditions on and off, and then when you weren't dealing with disabling health conditions, you were in college, you know so.
Which is what we're telling everybody to do. Like, you're supposed to go to college.
Right,
Well,
exactly,
I
exactly.
mean,
But I think that just shows you that the Social Security disability system is also built for a time period in which far less people were college educated, and a significant the greater significant percentage of people who received disability were not people who, went to college, but more lower income families who were maybe in trade schools and got injured or whatever. So I feel like it's just not a system that is built for the world that we live in today. And the problems with it that have been problems since the beginning have been amplified just by, the changes in our society. But it's definitely been really frustrating and eye-opening to butt against this. And on a more personal level, like, I'm queer. I will probably marry a woman. I would hope to be well enough eventually to like have a family. And as like lesbians, the only way really to confer like equal parental right to a child is to be married when that child is birthed and have both, parents recognized at that time. Otherwise, the birthing mother is the sole legal parent of that child, and the other mother is irrelevant if you're not married. And so that creates this issue too, where like say I receive disabled adult child benefits and I have to choose between like getting married and having parental rights over my child or having a source of financial income. That's not a choice that anybody should ever have to make. You know what I mean? Like it's just ridiculous that that's the system
Yeah.
that we have. So
Well, and even if you're
yeah,
lucky enough to get onto Social Security disability, it's not a livable income. It's enforced
no,
poverty.
it's not.
Like it's
Yeah,
yeah, it's the whole system is rigged for
yeah,
failure.
yeah. But it's at least something. Like I have to like ask my parents for money to buy
Yeah,
vitamins that are ordered by a doctor because insurance doesn't cover that and food stamps
right.
don't cover that. And I don't have Social Security and I don't have a job, you know what I mean? Because
Yeah.
I'm literally always at the doctor. Like I had to do a chart for my disability application in December. There were only 3 weekdays that I didn't go to the doctor. It was the day before Christmas, the like Christmas Eve, Christmas Day, and the day after Christmas. And then also there were 2 weekends that I went to the doctor. So it's like
Wow.
it's literally every day. And yet they're like, well, you could just get a job and pay for your own vitamins. So
Wow. Nope.
the our yeah, our system really sucks.
It does. It really does.
Yeah. Yeah.
Do you have any final thoughts, or is there something you really wanted to say today that you didn't have the chance to say yet? I'm really glad both of you were able to come today. Thank you for being here.
Absolutely.
This really takes a lot out of you, but I appreciate it.
Yeah.
It's really enlightening hearing the struggles and stories from both of you directly. I really appreciate you guys coming here today.
Of course.
The amount of knowledge that you both have is just like, I'm just like, whoa.
Right?
Yeah. I mean, when I was your age, I was, a total ding dong, and I'd be like, what? I'm not gonna wear a mask, and I don't care about COVID. So,
Yeah.
for you to have such a wealth of knowledge, just that knowledge, like passing it on to anyone, that's something that's really great.
Yeah.
But speaking, like hearing both of you speak, it's like these two doctors are these two,
Right?
it's like they're saying words that I can't even, pronounce, and I'm like, wow, like, you just have so much knowledge, and it's great, and to see that you've become such strong advocates for yourselves, and you're not, you are looking to the future. I mean, that's something that's really inspirational. I thank you for that, and like I said, the knowledge that you're passing on that's a huge gift, right? It is. It's really awesome, and thank you for that. So
Well,
Thank
thank
you.
goodness.
I mean, I really appreciate you giving us a platform to kind of share about our experiences because I think, another a challenge with this is that we're extremely isolated. Like when
Yeah.
I, got sick at school, my friends stuck around for a couple of months once they realized I couldn't go to the club with them anymore and I was in bed at 9 p.m. every night and, we weren't eating nachos at 1 a.m. in the study hall. Like I lost those friends and and my lifestyle just became so different from all of my peers that it became extremely difficult to sort of build those relationships. Like my closest in-person friend that I have now, my like home health nurse, like found a convoluted way to like get around HIPAA and introduced us because we're close in age and dealing with similar health issues. Um, and I see her and her service dog maybe once a month, but other than that, like I really only leave the house to talk to doctors. And I think that that makes it really difficult sometimes for our peers to like see us and remember us and understand kind of what we're going through. So I think that platforms like this are really important just for us to be able to say like, hey, like we're still here, we're still dealing with us. Like you don't see us, but it's happening and it's real. And those ding dongs you talked about, like we encounter them all the time, even in the medical field. Doctor that won't wear a mask, people who are like coughing all over us in the waiting room, and especially being immunocompromised. And I know for Marisa too, continuing to have lung issues, like it's terrifying to like have to go to the doctor to like deal with long COVID, and then someone's coughing COVID all over you in the waiting
Oh,
room, and then the doctor's coughing COVID all over you in the exam room, and it's
Right.
just every encounter is a risk. So yeah, it's just a matter of like continuing to remind the people that are still able-bodied and not affected by long COVID that like A, it could affect them at any time, and B, there are people in their environment that need need their protection, and it goes a long way, just a little bit of care to like put on a mask and show that respect.
Well, and nobody likes going first. Nobody wants to go first, but you have really taken the machete through the jungle, and you're doing this for a lot of people who are coming after you. So thank you.
absolutely. Thank you so much for the story. Um, all right. If there are no more questions, then I think we can wrap this up. Um, I will let folks know that we will get this recording up onto YouTube, and I will share it with everybody who's registered for it. So Ariana and Marisa, hopefully, it's something that you guys can share with friends and family later too. Um,
Thank you.
all right.
Well, thanks for being here, Marisa and Ari. It's
Thank
good to see
you.
you.
You too.
Yeah, it's so nice to meet you guys. Thanks so much for coming.
Of course.
Yeah, thank you so much for sharing your stories. It's an lot to process, but very important that people hear about this and know about what people are going through. Thank you, everyone.
Yeah, thanks everyone.